Now I invite for keynote address the most renowned and highly qualified Dr. Goh CHENG, Director, Traditional and Complementary Medicine Division, Ministry of Health, Malaysia.
Thank you, Madam MC. Okay, so His Excellencies, Mr. Ashraf, High Commissioners of India in Singapore, Associate Professor Dr. Muhammad Ibrahim, Senior Parliamentary Secretary, Ministry of Social and Family Development, and Mr. Murali Pillai, Members of Parliament, and Dr. Patrick Dua, representative from the Ministry of Ayush, India, and Dr. Indusekar from APAS. Good morning. Morning, just 2 minutes before 12 noon. Still in the morning. Okay, distinguished guest speakers, as well as ladies and gentlemen. Okay, today I have the pleasure and privilege to be with you all here in this auspicious day. I would say that International Yoga Day. Okay, and I would like to share with you all regarding the traditional and complementary medicines in Malaysia. Prior to my presentation, I would like to thank the Ministry of Ayush, as well as the High Commissioners of India in Singapore, as well as APAS for their kind invitations. Okay, my presentations I will touch upon the global overview, then followed by traditional and complementary medicines interpretations in Malaysia, and national policy and regulations of TNTM practices and products, as well as I will touch slightly on the practices on traditional Indian medicines practice. Global overview. As majority of us realize that globally there are so many people use traditional and complementary medicines TNTM. Roughly, globally, about 82% of the global populations have used TNTM. So, the potentials of traditional medicine should not be ignored. It should be fostered. So, how about in Malaysia? In Malaysia, according to our National Health Mobility Survey 2015, this is the survey, National Health Mobility Survey 2015, reported that about 29.51% of the population has used TNTM in Malaysia, okay, and 21.91% of the population has used some form of TNTM for the past 12 months in the year of 2015 survey. But majority of the practices, the preference is Malay medicines, about 52%, followed by Chinese medicine and complementary medicines. So everyone must surprise. Traditional Indian medicine, only 1%. Bear in mind, Malaysia's population, Indian population is only 7%. Okay, majority of the Malaysian populations are Malay Muslim. So it doesn't show that Chinese as well as Malay, they never go to Indian medicines. No, they also go to Indian medicine. Maybe we did not manage to capture them. Okay. Okay. Now, majority of the traditional and complementary medicines in Malaysia used to maintain wellness. Okay. And some of the minor illness, for example, cough, sprain, and muscle pain. Now, let us turn to what is traditional and complementary medicines in Malaysia. So, practice of TNTM in Malaysia is known to be a form of health-related practice designed to prevent, treat, or manage ailment or illness, or preserve the mental and physical well-being of an individual, and includes such as traditional Malay medicine, Chinese medicine, Indian medicine, Islamic medical practice, complementary medicine, and homeopathy. Okay, these are the practice of TNCM in Malaysia. Now, at this moment, I would like to share with you the important milestone in the development of TNCM in Malaysia. In fact, we have started in the 1987. A paper was presented to the Parliament, a research paper regarding the alternative medicines, and received the endorsement from the Cabinet. So, following that, a unit was formed, known to be a TNCM unit under the Family Health Development Divisions. Subsequently, establishments of the TNCM Standing Committee in 1998 and 1999, TNCM umbrella body was formed. So this umbrella body comprised of Indian medicines, Malay medicine, Chinese medicine, complementary, and homeopathy group. Okay. Subsequently, we got a herbal medical research center, and moving in line with the World Health Organization, Malaysia also had taken a very proactive step to formulate a national policy on traditional medicines. So subsequently, we also have this global information hub, something like a research portal. I use research portal in India. In this is a electronic database containing of very updated information on integrated medicines. Then traditional and complementary medicine divisions was established in the year of 2004. This is the division where I'm here. Okay. Next, these are since 2007, traditional and complementary medicine services has incorporated into our public hospital, public healthcare facility. So until today, there are 14 public hospitals offer TNCM services, include also 2 health clinics. The first is Masai Health Clinic in Johor, second is Menanti Health Clinic in Kelantan, and also 1 Malaysia Loris Birth Center, Mawib, in Putrajaya. So these are the public healthcare facility offer TNCM services. It doesn't mean that private they didn't offer. Yes, in fact, TNCM was privately driven in Malaysia, mainly practiced in private. Okay. Now, come to the policy and regulations for traditional and complementary medicines. Malaysia, this policy is regarding what? Is nothing special, nothing away from our modern medical policy as well. So it is to ensure quality and safe use of TNCM practice and product in Malaysia, and facilitate the integrations of TNCM into our healthcare system. So there is a paradigm shift, okay, for TNCM in Malaysia, from self-regulations to statutory regulations in 2016. The Traditional and Complementary Medicines Act 2016 was gazetted on 10 March 2016, and a council was established this year on 16 January. So, what are the objectives of this act? Is to ensure high quality, effectiveness, and safety of the TNCM practices. Okay, can you see the word practices? So this act is to register the practitioners, okay, but not product, and as well as to provide a compulsory registrations of TNCM practitioners and determine an eligibility requirement for each type of TNCM practices, and also enforce the registrations. Now, just now I have mentioned TNCM Act only regulate, monitor the TNCM practitioner. Everyone must have wondered, how about the product? How about the research? Yes, now, let me lead you to this. Come to the product, okay? It was under the National Pharmaceutical Regulatory Agency, also under Ministry of Health. But is under this following act, okay? Sales of Drug Act, Poison Act, 1952, as well as Dangerous Drug Act. So it is not under PODAC, it's not under TNCM Act 2016. Come to the research. For traditional and complementary medicine divisions, we also work very closely with the research agency to have research done, okay? Now, in Malaysia, at this moment, 11 private higher education institutions offer TNCM courses. There are about 7 undergraduate and 5 diploma academic courses was offered by them. Then, where is Ayurveda program? Where is Sita program in Malaysia? Coming soon. So I say it's coming soon. Okay. There is a university known to be a Tunku Abdul Rahman University. Okay. They plan to offer Ayurveda program. It's a bachelor program. They have signed MOU with India, government of India, and there will be an Ayush chair will be deputed in Utah to help them. Okay. Thank you. So now, because of the time constraint, I have to restrict myself to share with you all regarding the Indian medicine service in the public healthcare facility only. So, in 2010, there is a MOU was signed between Malaysia government, Ministry of Health, and the government of India regarding the development of traditional Indian medicines. Subsequently, in 2011, so that Shirodara service was introduced into our public hospital with the deputations of 1 Ayurvedic physicians and 2 therapists helping Malaysia to set up the traditional Indian medicine service in the public healthcare facility. And then, so sorry, subsequently, in 2015, there is external pasti therapy. We extend the service apart from offer Shirodara, we offer external pasti. This year, we plan to offer Vamam therapy, which is a Sita medicines. Now, this these few pictures demonstrate the Shirodara service during the site visit by our Deputy Director General, Dr. Jayendran, okay, together with the Secretary of Ministry of Ayush. So is Mr. Niranjan Saya, as well as Joint Secretary. So they visit our Cheras Rehabilitation Hospital. It's one of our public hospital. Okay, only 2 public hospitals in Malaysia offer the Shirodara as well as external pasti services. Now, in Malaysia, before any of the service offered in the public hospital, we have to develop a guideline. So, a TNCM guideline on this Shirodara has been developed, and we constrain ourselves only to offer and take care of the illness such as insomnia, stress and mental fatigue, anxiety, mild depression, and headache. It's just to help the TNCM practitioners or so-called Ayurvedic practitioners and in the practice to understand what is the practice in the hospital, as well as educate the public in Malaysia, and also to help the medical doctors to understand the TNCM practices. So this is the external pasti therapist. The launching has been done by our Deputy Director General, Dr. Jayendran, as well as the High Commissioners in Malaysia, Mr. Tirumati. The indication is for long-standing conditions like backache. Sorry, this is on Wamam. We have launched the Wamam guideline together with this Indian government, means during their visit to Malaysia for the 4th bilateral technical meeting. I think this group was led by Mr. Anil Ganariwana. Okay, so the indication is also for frozen shoulders, osteoarthritis of the knee. Now, I just would like to share with you all the services being offered in public hospital, so you can see increasing number of the patients to go for Indian system of medicine. There is a drop of Shirodara here because we offer the external pasty. You know, people would like to try a new thing, am I right? So once the external pasty therapy offer, everyone go for external pasty, okay? It doesn't show that Shirodara is not good, okay? I think this will be my last slide. I will end my presentation with a way forward. Okay, the first one is on public engagements on TNCM's regulation, just to educate the public as well as get their feedback to further improve our regulations and help the professionalize or facilitate professionalizations of TNCM practitioners in Malaysia. Then we would like to implement the enforcements of the TNCM Act 2016 and promoting evidence-based practice, which has been highlighted by His Excellency, okay? So evidence-based. And now also would like to expand the service to primary healthcare level, and we are in the midst of developing national TNCM blueprint in Malaysia. And finally, I would like to end my presentation with emphasize an importance of consumer education to educate the consumer regarding the importance of proper use of TNCM practices and products. Thank you very much for your kind attention.